Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about the other surgeries that can be done for a bunion. So, again, let's give you a quick reminder. A bunion is a prominence of the first metatarsal head where actually the bone is tilted out, toe turns in, you get a prominence, you get pretty significant pain here. And we also talked about hallux limitus, hallux rigidus with the bunion on top, a dorsal bunion. We're not going to talk about those surgeries right now. We will do those over the next couple of days. But today, I want to just talk about the other surgeries that can be done for a bunion. We talked about the most common, which is surgeries at the head of the first metatarsal for bunion surgery, the Austin bunionectomy being the most common, where you actually take a V through that, move the bone over, and fix the problem. There are other surgeries that can be done. There is a surgery called an Aiken type procedure, a procedure where you can actually do a cut into the smaller bone here. If you have a severe angling of that, you can actually use that to help angle this bone back if necessary. You can do cuts in other parts of the bone, whether it can be further back here or the base. You can actually do such things as cuts where you open it up and put bone inside, or you cut it, create a wedge and take the wedge out so it moves the things over. You can also do different types of cuts at the base. There is one called a crescentic cut where you actually do a rounded cut, which allows you to rotate that bone. So when it's really tilted out, you can rotate it back into position. And in some situations, you've got a joint that's just hypermobile. It's just not, it's moving more than it should. And you end up doing the surgery further back. You end up having to do what's called a lapidus, which is a fusion of this joint back here, because the bone is so mobile that any of the other surgeries you do will cause it to recur. It will come right back. So really, when it comes down to a bunion, it depends on how severe the problem is and how many issues there are with the whole ray, the first ray, the whole complex of these bones. And if there's, based on those issues, will determine what surgery needs to be done. So it is important that you get evaluated, that they do x-rays, that they determine from those x-rays how severe is a deformity and what can be done. Because as you move from here back, you're getting more ability to make a change. So you can say, okay, if I'm just out here, it's going to be a smaller change. And as we move further back, we're going to get more and more and more change. It also requires longer recovery and longer healing and so forth. Because if you're going to fuse a bone, or if you're doing something further back where it's going to take longer to heal, you have to be immobilized a little bit more and so forth. So basically, when it comes to doing a bunion surgery, or you're having surgery on your foot for a bunion, you need to say, okay, how severe is it? And what's the recommended procedure for that? Number two, what's the recovery of that procedure? And is there a procedure that will do enough that will allow me to recover quicker? So that you can weigh it and say, okay, I know that the best procedure is this one, but I can recover quicker with this one. And this one's going to do enough to alleviate my symptoms, get me back to normal. It may not make my foot look completely normal, but it may be a better option. So you want to make sure you have all the options, and they should be presenting you all the options, not just one option when they talk about a bunion and talking about fixing a bunion. This is Dr. Brandt Gibson, and this is Podiatry Tips Day 248, the other bunion surgeries. And there's multiple surgeries. That's why I didn't go into great depth with them, because what's going to happen is you can actually say, okay, I have a severe bunion, a severe problem. Let's talk about the best option and the alternative options for that.